Today, a federal investigator said the Department of Veterans Affairs for years ignored whistleblowers who tried to report problems at VA hospitals and clinics. The VA has come under fire for making patients endure long waits for medical care. Wyatt Andrews has been looking into this.
In a letter to President Obama, the U.S. Special Counsel Carolyn Lerner accuses the VA of repeatedly failing to use information from whistleblowers and not acknowledging where the VA's problems might impact its patients. Lerner named 10 different hospitals where the VA admitted that whistleblowers were correct about patient neglect, Legionnaire's contamination, and falsified wait times, but in every case the VA never admitted that any patient suffered harm. Lerner says the VA is in a culture of denial.
Well, often we would send the reports back to the VA and sort of say in a very nice way, kind of, are you kidding us here?
For example, Lerner reports that the VA's Office of Medical Inspector found no harm when 2 mental health care patients spent more than 7 years in the Brockton, Massachusetts VA hospital, with each receiving 1 medical exam. No harm was found in the Fort Collins VA after 2,800 veterans had their medical appointments canceled without notice, and after the hospital admitted it was hiding how long its veterans waited for care.
It's impossible, I think, to conclude that no one was harmed when there were such long delays in getting them medical care.
Did you find that in some of these cases they did not find patient harm because they weren't looking?
That's right. On the waiting list case out of Fort Collins, they didn't even look to see whether patients had been harmed.
Lerner recommended that the VA begin to investigate exactly how it has been handling these VA whistleblower complaints. Scott, the acting VA Secretary Sloan Gibson immediately agreed with that finding and promised a review.
Wyatt Andrews in Washington. Wyatt, thank you very much.